So really, thanks a lot for the invitation to participate today. I know we only have 4 minutes, so I'll keep it really brief. The idea of what I'd like to cover is hopefully going to spark some collaborations and talks. And if you would like to learn any more about this, you can also reach out to me at klane@bu.edu. Super simple to find me. And I'm just going to show you an example of 3 different projects in which we're using cloud processing as well as machine learning on local, national, and global topics. And I'm going to start off with one of the projects where I'm PI on to help give you a flavor of what we're doing in the Department of Environmental Health, as well as the Center for Climate and Health. We're engaging with a lot of data repository development, as well as code generation to make processing across different avenues and different types of analyses more efficient. Specifically in this project, it's a nice example where we're taking large quantities of second-by-second data from the last 5 years, where I'm PI of this study known as Community Measurements of Aviation-Related Air Pollution at Logan Airport. We have stationary monitors collecting air pollution in communities near Logan Airport. We also have electric vehicles and drones we fly around to collect high-resolution data. And then we're feeding it all into a data system within the RCS and RCC in the on-demand predominantly. And then we're utilizing machine learning models, specifically random forest, as well as gradient boost, and starting to test some neural networks with the idea of being able to identify the contributions of landing and takeoff planes in flight and their contributions individually, so we can help fill the gap in the Federal Aviation Administration to better understand and potentially create emissions for an unregulated air pollutant known as ultrafine particles. So this is an example of utilizing machine learning with high resolution data that is spatiotemporally very complex. Another example is an industry collaboration known as the Shared Care Community Wellbeing Study that is led by Kimberly Dukes, a professor of biostatistics at the School of Public Health. And in this group, I lead the geospatial social terms of health data processing. And what we've done is we've worked originally with AWS and RCS here at BU to help develop ways to quickly process and conduct service area or distance level analyses for point as well as abnormal polygon shapes. You can see here on the right, like parks, to help improve exposure assessment and identifying what is walkable or drivable locations. We pair this with a data set that was purchased a year ago through Data Axle, where we have information on every single business across the entire United States. So now we're able to process things like access to liquor stores, access to convenience stores, access to grocery stores nationwide. And this work is in collaboration with RCS, being led by Keith Spangler at EH, Dennis Millichin on the RCS side. And this work moved recently from AWS to NERC because it was computationally impossible to do the spatial processing on the cluster itself. Another example is going global now, in which we are providing support through the cluster to do ensembling of machine learning across multiple different groups. This is 5 different universities from across 3 different continents, and we're hosting and running all the data on our own systems here at BU. And I can say this project would not be running or available for LMIC collaborators in India if we weren't hosting and allowing that external collaborator work to be integrated as well. The goal on this is we finally have finished developing our 1 kilometer by 1 kilometer daily PM 2.5, as well as temperature models for all of India, 3 million grids for the entire country, and we're making it publicly available for epidemiologists to do health studies in India itself. And the methods we're using is ensemble and machine learning approaches that you can see here. And just to wrap it up, to give you a little bit more plethora of the variety of different projects, it's not just me that leads these things or as a partner, it's really a variety of different researchers at EH and at BUSPH that are working on these different pieces as well. At that point, I'm just going to wrap it up so we can go to the next talk.